Part 1. CNA Practice Test for Basic Restorative Services. Question 1. Proper body mechanics dictates that when lifting an object, the nurse aide places his feet A. 3 feet to 5 feet apart, B. 12 in to 18 in apart, C. 6 in to 12 inch apart, D. It doesn't matter. Answer B. 12 inch to 18 in apart. Explanation. When lifting any heavy object, start by placing your feet shoulder width apart, about 12 to 18 inches, with one foot slightly in front of the other. Sweat down, bending only your hips and knees. Keep your back straight and shoulders back as you slowly stand. Never twist or turn as you lift. Hold the object close to your body, near your navel. Question 2. What is the process of restoring a disabled client to the highest level of functioning possible? A. Retention. B. Rehabilitation. C. Reincarnation. D. Responsibility. Answer B. Rehabilitation. Explanation. Rehabilitation is the specialized care that helps a client get the best possible level of function and independence possible. The rehabilitation process is used to restore physical strength and movement after surgery, illness, or trauma. It cannot reverse the damage, but can assist the client to attain a better quality of life. Question 3. The nurse aide just admitted a new resident. Which of the following is the most restorative approach? A. Encourage a family member to unpack for him. B. Unpack all of his clothes and put them away for him. C. Tell them he'll need to unpack for himself. D. Encourage the resident to participate in unpacking. Answer D. Encourage the resident to participate in unpacking. Explanation. Helping clients return to their previous state of health includes having them do as much for themselves as possible. Engaging them in activities encourages them to be independent throughout the restorative process. Also, clients who are involved in decision making are more likely to be compliant with treatment. Question 4. A nursing assistant is helping a resident to walk. If the resident becomes faint and begins to fall, the assistant should A. Ease the resident to the floor and call for help. B. Hold the resident up and call for help. C. Carry the resident back to bed and then go for help. D. Hold the resident up and continue walking. Answer A. Ease the resident to the floor and call for help. Explanation. Before helping any resident walk, take time to assess how much assistance will be needed. Allow the resident to sit at the edge of the bed and dangle their legs before standing. When walking, if the resident becomes weak or dizzy, protect them and yourself by easing the resident to the floor. Do this by holding them under the arms while putting one of your legs forward to support the resident while lowering them to the floor. Keep your knees bent to avoid a back injury. Question 5. After assisting with evening care, the nurse aide notices the client has bilateral hearing aids. The nurse aide understands that if a hearing aid is not in use, it should A. Be left on the client's bedside table. B. Be placed in the client's pocket. C. Have the battery disengaged. D. Be left turned on. Answer C. Have the battery disengaged. Explanation. When hearing aids are not going to be in use for several hours or overnight, disengage the battery to make it last longer. The battery can be removed, but it is easier to open the door of the hearing aid and leave the battery inside. Clients with limited vision or poor motor skills will be able to close the door and insert the hearing aid easily. Never leave hearing aids where they can get lost, misplaced, or damaged. A drawer or container are safe storage places. Question 6. Goals of arthritis care include A. Decreasing inflammation and preserving joints. B. Strengthening bones and muscles. C. Preventing contractures. D. All of the above. Answer D. All of the above. Explanation. Arthritis is a common chronic disorder of the joints. It involves pain, swelling, and stiffness that can limit movement. Care of a client with arthritis includes a wide range of ongoing treatments to decrease inflammation and maintain the joints. Stretching, exercise, heat and cold, and anti-inflammatory medications can be helpful. Question 7. The most basic rule of body mechanics is to A. Bend from the knees and hips. B. Twist as you lift. C. Never use a lift belt. D. Keep the arms flexed. Answer A. Bend from the knees and hips. Explanation. Proper body mechanics uses the legs to do most of the work. Keep your back straight and locked. Do not turn or twist. If you bend, do so at the knees and hips, not the waist. Before lifting or moving a client, assess how much the client is able to do. If you have any doubts, always ask for assistance from a coworker. Question 8. Mr. Johnson has just returned from surgery. Which of the following things do you do? A. Immediately give medication to control nausea. B. Check vital signs every 4 hours. C. Notify family about the surgery results. D. Turn, cough, and deep breathe leg exercises. Answer D. Turn, cough, and deep breathe leg exercises. Explanation. The two most common post-operative complications include atelectasis, fluid collecting in the lungs, which can lead to pneumonia, and blood clots, which can break off and travel to the lungs. The nurse aide can help the client turn in bed, as well as take deep breaths and cough to make sure enough air gets into the lungs. Leg exercises and getting out of bed as soon as possible can increase circulation to avoid blood clots. Question 9. REOM exercises will help prevent A. Pressure sores. B. Obesity. C. Contractures. D. Depression. Answer C. Contractures. Explanation. A contracture is a shortening of muscles, tissues, tendons, and skin at the joints due to lack of movement and exercise. When joints remain bent over time, they can no longer be straightened. Range of motion (ROM) exercises provide a way to maintain joint flexibility. In passive ROM, someone moves the joints with no assistance from the client. In active ROM, the client does not exercises alone or with the help of devices such as a strap. Question 10. A patient is leaving the hospital. The family has been told to give her medication speed. The wife asks what that means. The nurse aide tells her to give the medication. A. Once a day. B. Twice a day. C. 3 times a day. D. Only when needed. Answer B. Twice a day. Explanation. BID is an abbreviation used in medicine and pharmacy to indicate 2 times each day. The medication should be taken every 12 hours. BID is also written as BID or BID. Question 11. Exercises that move each muscle and joint are called A. Range of motion, B. Rotation, C. Abduction, D. Adduction. Answer A. Range of motion. Explanation. Range of motion ROM exercises provide a way to maintain joint flexibility. In passive ROM, someone moves the joints with no assistance from the client. In active ROM, the client does the exercises alone or with the help of devices such as a strap. ROM is important to prevent contractures. A contracture is a shortening of muscles, tissues, tendons, and skin at the joints due to lack of movement and exercise. When joints remain bent over time, they can no longer be straightened. Question 12. If a client has hand tremors, the nurse aide should A. Assist the client with the activity of daily living as needed. B. Do everything for the client to avoid embarrassment. C. Tell the client to stop shaking and to control the tremors. D. Restrain the hand that has the tremor. Answer A. Assist the client with the activity of daily living as needed. Explanation. Hand tremors are the most common type of involuntary movement. There is no cure for tremors. Treatment includes physical therapy, occupational therapy, and medications. Therapy can help clients learn to do many tasks for themselves. Adaptive devices, such as special eating utensils, can support their efforts to be independent. Question 13. A button hook and a sock assist are all part of what kind of nursing care? A. Disability and reactivity. B. Prosthetic mobility. C. Restorative and rehabilitation. D. Activities of daily living. Answer C. Restorative and rehabilitation. Explanation. When clients are recovering from illnesses or accidents or learning to live with disorder, special items can be used to help the clients adapt to the situation and be as independent as possible. Two types of healthcare professionals assist clients with these goals. Restorative medicine is a new branch of medicine that works to restore a client's health, not just treat symptoms. Rehabilitative medicine specializes in treating clients with painful or limiting physical conditions. Question 14. The role of the Ombudsman is to A. Control the nursing home budget. B. Run a group of nursing homes. C. Work with the nursing home to protect clients' rights. D. Prepare classes that nurse aides take to learn about client hygiene. Answer C. Work with the nursing home to protect clients' rights. Explanation. An ombudsman is a trained advocate for clients' rights in a long-term care facility. They assist clients and their familiars with any issues or disagreements that occur at the facility. Examples are inadequate services, lack of privacy, poor food quality, or problems with other residents. If the client or family is unable to resolve a problem with the staff, an ombudsman can negotiate on their behalf as well as find other resources to help them. Question 15. Pressure sores can often be prevented if the client is A. Positioned with a pillow under the head. B. Turned or repositioned every 2 hours. C. Placed in an incontinence brief. D. Dressed in loosely fitting clothing. Answer B. Turned or repositioned every 2 hours. Explanation. One of the primary responsibilities of a nurse aide is to monitor the client's skin for any signs of breakdown that could develop into bed sores, also called decubitus ulcers or pressure sores. During bath, dressing, or position changes, inspect the skin for redness, pallor, warmth, or bruising. Reposition at least every 2 hours, protecting areas that rub together as well as the bony prominence. Massages to the back and buttocks can promote circulation. Range of motion exercises are also helpful. Always report any signs of breakdown to the nurse. Question 16. When ambulating an unsteady client, it is best for the nurse aide to use A. Quad cane, B. Wheelchair, C. Walker, D. Gait belt. Answer D. Gait belt. Explanation. Using a gait belt when helping a client ambulate allows the client to walk with support and prevent a fall if the client becomes weak. It also reduces back strain for the nurse aide. A gait belt is also used to help a client stand from a sitting position and transfer to a chair. Question 17. A patient has had hip surgery. Her legs should be A. Elevated, B. Adducted, C. In the most comfortable position for the patient, D. Abducted. Answer D. Abducted. Explanation. Following hip surgery, the client should be positioned to maintain natural alignment of the leg. A pillow, abductor pillow, or wedge is placed between the legs, keeps the legs in the correct position. Ankles and legs cannot be crossed, and toes should point toward the ceiling. The hip should not be rotated inwards or outwards. The client can never lie on the non-operative side. Question 18. You are delegated to provide passive ROM to our lower and upper extremities. This means you A. Support each joint and provide extension and flexion movements on the left side of the body. B. Extend right arm over the left side of the body. C. Watch how many times she moves left lower and upper extremities in 15 minutes. D. Have patient raise left arm and leg 10 times. Answer A. Support each joint and provide extension and flexion movements on the left side of the body. Explanation. In passive range of motion, PROM, the client's joints are supported and moved by someone else. The client does not participate in the exercises. PROM keeps joints flexible but does not build muscle. Active ROM is necessary to increase strength. Question 19. Equipment used to help the resident maintain correct body alignment includes all of the following except A. Bed cradles, B. Foot supports, C. Cones, D. Splints. Answer C. Cones. Explanation. Proper body positions maintain good body alignment, which is necessary to help the client feel comfortable, as well as avoid complications. Foot supports prevent foot drop by keeping feet in their natural position. Splints can be stabilize a limb or joint. A bed cradle protects a part of the body by keeping the weight of sheets and blankets from touching the client. Question 20. What can you do to allow a helpless resident some independence when he must be fed? A. Always stand to feed the resident. B. Feed the resident lying down. C. Feed the resident with a fork. D. Ask which foods the resident would like to eat first. Answer D. Asked which foods the resident would like to eat first. Explanation. If a resident is dependent on staff for total care, try to create ways that give the resident a sense of control. During meals, allow the resident to choose the order of foods and beverage. When getting dressed, offer choices of clothing. Ask which television show the resident would prefer. Making decisions gives residents a way to participate in their care. Question 21. A contracture, tightening, or shortening of a muscle is caused by A. Too much exercise, B. Old age, C. Lack of movement of the muscle, D. Pressure on the muscle. Answer C. Lack of movement of the muscle. Explanation. When a muscle is not moved or exercised, it can shorten and become stiff. Range of motion ROM becomes limited and movement can be painful. Prevention is important when a client is immobile or has a disorder that can lead to contractures such as cerebral palsy or muscular dystrophy. Stretching, performing ROM exercises, and using splints can help maintain function. Question 22. The nurse aide documents that about 45 minutes after the resident is put to bed for an afternoon nap, the resident urinates in bed. To help with bladder training, the nurse aide should A. Take the resident to the bathroom right before going to bed. B. Report to the registered nurse that the resident will not succeed in bladder training. C. Take the resident to the bathroom after about 30 minutes of being in bed for the nap. D. Remind the resident that it is important to cooperate with bladder training. Answer A. Take the resident to the bathroom right before going to bed. Explanation. Bladder training is an effective way to help clients gain control over urinary incontinence. Toileting is scheduled at specific times during the day, including before and after bed. The times between using the bathroom are gradually increased. Bladder training takes about 6 to 12 weeks. Question 23. When the nurse aide moves a joint during ROM, range of motion, exercises, and the resident complains of pain, the nurse aide should A. Stop the movement at the point the pain occurs and report to the nurse. B. Push past the point where the pain occurs to see if it still hurts. C. Stop giving the resident any ROM exercises. D. Ask the nurse to give pain medication so the exercises can continue. Answer A. Stop the movement at the point the pain occurs and report to the nurse. Explanation. Range of motion exercises provide a way to maintain joint flexibility. Each joint is moved as far as it can comfortably go. The client may feel slight discomfort as the muscles are stressed, but never push beyond the point of pain. If the client reports pain, stop immediately and report to the nurse or therapist. Question 24. The primary goal of restorative care is A. Do everything for the resident. B. Take care of the resident's personal business. C. Return the resident to a normal life at home. D. Keep the resident comfortable in the nursing home. Answer C. Return the resident to a normal life at home. Explanation. Restorative care provides specialized services to help a client regain the highest possible health and function and to prevent decline. The goal is to assist the client to return to a home setting and live independently. Rehabilitation methods are used to teach clients activities of daily living, speech, and safety. Question 25. The nurse aide is making an occupied bed. Which of the following is the most restorative approach? A. Encourage the resident to help. B. Lower both side rails. C. Tell the resident to get out of bed. D. Do everything for the resident. Answer A. Encourage the resident to help. Explanation. Even clients who must remain in bed can often still participate in their care. They can move and turn in bed during the lean and change. They can assist with their bed path and perform their own oral care. The nurse aide should encourage the client to do as much as possible. Question 26. Restorative nursing care is the process of A. Providing care for the needs of the whole person. B. Restoring rest and brains for those who haven't had them. C. Doing everything we can to prevent fatigue. D. Focusing specifically on what the resident cannot do. Answer A. Explanation. Restorative care provides specialized services to help a client regain the highest possible health and function and to prevent decline. The goal is to assist the client to return to a home setting and live independently. Rehabilitation methods are used to teach clients activities of daily living, speech, and safety. Question 27. Mrs. Wilson is in your facility for rehabilitation after a hip replacement. Her husband wants to help give her a bath and she agrees. What should you say? A. Great. I can take a longer break while you give her the bath. Let me set you up. B. I'm sorry, but it's against policy to let anyone but staff take care of the patients. C. How sweet. Let me gather everything and we can do it together. D. I must protect the privacy of my patients. You will need to leave while I bathe her. Answer C. Explanation. If a resident agrees and the nurse approves, family members can assist with tasks such as bathing. This can be a useful teaching tool for families who will be providing support when the resident returns home. Studies have shown that residents may eat better and less likely to become depressed when the family can provide some physical and emotional support. Question 28. What is the term for a device used to take the place of a missing body part? A. Pronation. B. Prosthesis. C. Prognosis. D. Practicum. Answer B. Explanation. A prosthesis is a device that replaces a part of the body that is missing from surgery, accident, or at birth. It helps restore function for the client. It can also improve a client's appearance. A prosthesis can be made for eyes, teeth, arms, legs, joints, or breast. Question 29. Residents who are bedridden face all following risks except A. Blood clots, B. Pneumonia, C. Increased muscle strength, D. Calcium loss. Answer C. Explanation. When the resident is unable to get out of bed, there can be many serious complications because lungs can't fully expand, pneumonia can develop. Without weight-bearing activity, calcium leaves the bones, causing bones to thin. And with sluggish circulation, blood clots can form, especially in the legs, muscles can atrophy, and there is a risk of developing contractures. Question 30. When walking a resident, a gait or transfer belt is often A. Put around the resident's waist to hold onto the resident. B. Used to keep the resident positioned in the wheelchair. C. Used to help the resident stand, then removed before walking. D. Worn around the nurse aide's waist for back support. Answer A. Explanation. A gait belt provides support and stability for the resident during walking or transfer. When putting on a gait belt, it should fit snugly, with just enough room to insert two fingers. It goes over the client's clothing with the buckle in front, walk behind slightly to the side of the client, grasping the belt from the underside. Always remove it when you finish walking. Question 31. Which of the following statements is true about range of motion (ROM) exercises? A. They are often performed during ADLs. B. They can help prevent strokes and paralysis. C. They are done just once every other day. D. They require at least 20 repetitions of each exercise. Answer A. Explanation. A way to ensure that range of motion exercises are done is to incorporate them into ADL tasks. ROM provides a way to maintain joint flexibility. In passive ROM, someone moves the joints with no assistance from the client. In active ROM, the client does the exercises alone or with the help of devices such as a strap. ROM is important to prevent contractures. A contracture is a shortening of muscles, tissues, tendons, and skin at the joints due to lack of movement and exercise. When joints remain bent over time, they can no longer be straightened. Question 32. Raising the bed to a comfortable position will help to prevent A. Back strain, B. Arm strain, C. Leg strain, D. Neck strain. Answer A. Explanation. Nursing care has the highest risk for back injuries. One study showed that during a shift, a hospital nursing staff member will lift 20 patients and transfer 5 to 10 patients from bed to a chair. Another study showed that lifting patients accounts for about half of all patient care-related injuries. Patients typically weigh more than 100 pounds, more than the maximum load for industrial workers. Working in a comfortable height is essential to prevent back strain and injury. Question 33. Exercises that can help maintain the movement of joints are called A. Muscle endurance methods, B. Range of motion, C. Joint effectiveness techniques, D. Abduction and adduction. Answer B. Explanation. Range of motion. Wrong. Exercises provide a way to maintain joint flexibility. In passive ROM, someone moves the joints with no assistance from the client. In active ROM, the client does the exercises alone or with the help of devices such as a strap. ROM is important to prevent contractures. A contractor is a shortening of muscles, tissues, tendons, and skin at the joints due to lack of movement and exercise. When joints remain bent over time, they can no longer be straightened. Question 34. When helping a resident get out of bed, what should a nurse aide do? A. Ask another nurse aide to help. B. Keep the side rails up. C. Raise the bed all the way up. D. Use good body mechanics. Answer D. Explanation. Each time you assist, move, or transfer a resident, remember to use good body mechanics to avoid hurting yourself. Proper body mechanics uses the legs to do most of the work. Keep your back straight and locked. Do not turn or twist. If you bend, so do at the knees and hips, not the waist. Before lifting or moving a resident, assess how much they are able to do. If you have any doubts, always ask for assistance from a co-worker. Question 35. When is an easy time to do range of motion exercises? A. While getting dressed, B. During the resident's bath, C. Before going to sleep, D. When the resident wakes up. Answer B. Explanation. Although range of motion can be done at any time, it fits well as part of the resident's bath. As you wash the arms and legs, put each line through exercises. If you do wrong with each line you're watching, you will not skip any areas. You can also do wrong while applying lotion after the bath. Question 36. Mr. Lopez is learning to use walker. What should the nurse aide do? A. Encourage him to walk by himself. B. Walk behind him using a gait belt. C. Put bedding on the walker in case he falls. D. Have him walk in place for 5 minutes. Answer B. Explanation. Using a gait belt with Mr. Lopez will keep him safe as he learns to walk. It can also protect both him and you if he loses his balance and starts to fall. Gait belt provides support and stability for the resident during walking or transfer. When putting on the gait belt, it should fit snugly with just enough room to insert 2 fingers. It goes over the client's clothing with the buck in front. Walk behind slightly to the side of the client, grasping the belt from the underside. Always remove it when you finish walking. Question 37. What would be the best way for the nurse aide to promote client independence in bathing a patient who has had a stroke? A. Teach the patient to wash their hands properly before doing anything else. B. Leave the patient alone and tell them to call you if they need any help. C. Encourage the patient to do as much as possible, offering help as needed. D. Do everything for the patient so they can watch how to do tasks properly. Answer C. Explanation. Regaining independence after a stroke can be challenging and frustrating. The nurse aide must be patient during the recovery process, encourage the patient to do as much as possible, offer assistance as needed, but always provide positive feedback for each gain. It can be tempting to do things for the patient, such as give a bath, but remember that the goal is to be as independent as possible, even if tasks are not done perfectly. Question 38. When a patient ambulates for the first time, the nurse should A. Take his temperature and pulse rate first. B. Watch for signs of dizziness and fatigue. C. Stay with him until he stands without assistance. D. Help him to stand up and pivot quickly. Answer B. Explanation. Ambulation is important for muscle strength, joint flexibility, and better circulation. When a patient has been ill or recovering from surgery, they may be anxious about ambulating for the first time. Assess how much help they will need. Can they walk, or will they need a gait belt, crutch, or walker? Take time to let the patient sit up and dangle for a few minutes on the side of the bed. Ask if they are dizzy or lightheaded before helping them stand. Do the same thing when they stand. If they seem steady, proceed to help them ambulate. Question 39. An elderly resident who is inactive is at risk for constipation. In addition to increased activity and exercise, which of the following actions helps prevent constipation? A. Low fever diet. B. Adequate fluid intake. C. Frequent snack times. D. High protein diet. Answer B. Explanation. Getting enough fluids is important in preventing constipation. Elderly people may not have an adequate fluid intake for several reasons. 1. Older people may not recognize when they are thirsty. They may need to be reminded to drink, or the nurse aide can offer a drink every 2 hours. 2. They may restrict their own fluids to avoid incontinence or frequent toileting. Scheduled toileting can reduce the chance of incontinence. 3. They may have a medical condition such as congestive heart failure or kidney disease that have restricted fluid intakes. If any resident is constipated on a regular basis, tell the nurse. Question 40. Mr. Brown is blind from an industrial accident. How can you help him learn to feed himself? A. Use a clock face to tell him where the food is. B. Offer to cut meat or butter bread. C. Tell him where the salt and pepper, water glass, and other items are located. D. All of the above. Answer D. Explanation. Patients who become blind as adults must learn to live without vision. Help them be as independent as possible by establishing a way to eat their meals. Set the table in the standard way. Say to them, your chicken is at 2 o'clock and your potatoes are at 6 o'clock. For other items, say, salt and pepper are above the fork and your water is above the knife. If food might present a challenge, ask, would you like me to cut your steak and put butter on your roll? Question 41. When helping a client who is recovering from a stroke to walk, the nurse aide should assist A. on the client's weak side, B. from behind the client, C. with a wheelchair, D. on the client's strong side. Answer A. Explanation. When helping a client walk who is recovering from a stroke, the nurse aide should stay on the client's weak side, walk next to and slightly behind the client in order to be ready to suddenly support the weak side. If the client is using a walker or cane, allow space for the device. When walking, be alert to avoid possible fall hazards. The client should wear slippers or shoes with rubber soles for traction. Question 42. What is the branch of medicine that deals with physical medicine and rehabilitation called? A. Physiatry. B. Psychiatry. C. Podiatry. D. Physiology. Answer A. Explanation. Physiatry is the branch of medicine that is involved with physical medicine and rehabilitation. It treats conditions that include the brain, spinal cord, nerves, bones, joints, ligaments, and tendons. If a nurse chooses to work in physiatry, they will have patients with cognitive problems, mobility issues, gait disorders, feeding and swallowing issues, and muscle conditions. Many of these patients will require care in assisted living and long-term care facilities. Question 43. The doctor has ordered physical therapy, PT, for every day of the week. The patient's religion does not permit any activity on Saturday. What should you do when PT arrives on Saturday? A. Tell the patient's family so they can decide if PT is allowed. B. Tell the nurse so they can call the doctor to change the order. C. Tell PT to come back for 2 sessions on Sunday. D. Tell the patient that they must follow the doctor's orders. Answer B. Explanation. Tell the nurse about the patient's religious beliefs so the nurse can contact the doctor to change the orders. The patient has the right to refuse PT on Saturday. If a patient's religion or culture does not permit activities or has diet restrictions, always respect those. For many patients, if they are not allowed to observe their religious rules, they may feel that they have violated the rules and could be punished. Do not force the patient to have PT. Question 44. Residents who have had a stroke are at risk for fall because of A. Balance problems, B. Difficulty walking, C. Cognitive changes, D. All of the above. So D. Explanation. Following a stroke, the risk for falling increases for several reasons. Muscles may be paralyzed or weakened, so the resident cannot rely on their former ability to balance and walk. Coordination can be impaired, so standing still becomes difficult. Changes in their cognitive function can cause them to make poor decisions, such as to refuse a cane or walker. New medications may have side effects that affect movement or thinking. Question 45. While helping a resident perform a range of motion, wrong, exercise, he complains of pain. The nurse should A. Ask the nurse to give a pain medication. B. Repeat the ROM exercise to see if it happens again. C. Ask to receive more training in ROM techniques. D. Stop the exercise at that point and tell the nurse. Answer D. Explanation. Range of motion exercises provide a way to maintain joint flexibility. In passive ROM, someone moves the joints with no assistance from the resident. In active ROM, the resident does the exercises alone or with the help of devices such as a strap. When doing or assisting with ROM, always stop if the resident complains of pain. Watch the resident for signs of discomfort, shortness of breath, or fatigue. If you observe any of this, stop and tell the nurse. Question 46. A cane should be used on the A. Dominant side, B. Preferred side, C. Strong side, D. Weak side. Answer C. Explanation. When using a cane, it goes on the strong side but moves with the weak side. This automatically shifts the person's weight to the strong side. To walk properly, place the cane the distance of an average step and move the weak leg with it. Do not surge or stretch to increase the distance. The strong arm and weak leg share the load. Steady the walk through leaning on the strong side while moving one step on the weak side, making sure the weak foot is placed securely before taking another step with the strong side. When climbing stairs, remember up with the good and down with the bad to maintain balance. Question 47. After Mr. Hall's stroke, his right arm is weak. He should be taught to A. Put his left arm into his shirt first. B. Put his right arm into his shirt first. C. The resident can decide which arm goes first. D. Put both arms in the shirt at the same time. Answer B. Explanation. Mr. Hall should use his left arm to put his right arm into his shirt first. When dressing a resident with one-sided weakness, teach the resident to use their unaffected side to dress the affected side first. When getting undressed, take the unaffected side out of the sleeve first. Clothing should be loose-fitting and comfortable. Question 48. To encourage blood circulation in residents who must remain in bed, you can do all of the following except A. Turn the resident every 2 hours. B. Rub the skin vigorously during a bed bath. C. Give back massages. D. Do passive or active roam exercises. Answer B. Explanation. Good blood circulation can keep residents healthy and prevent skin breakdown. During baths, dressing, or position changes, inspect the skin for redness, pallor, warmth, or bruising. Do not irritate fragile skin with vigorous rubbing. Reposition at least every 2 hours, protecting areas that rub together as well as the bony prominences. Massages to the back and buttocks can promote circulation. Range of motion exercises are also helpful. Always report any signs of breakdown to the nurse. Question 49. To move a resident up in bed when they are able to move with assistance, the nurse aide should A. Position yourself with knees straight and bent at the waist. B. Pull the resident up holding one side of the draw sheet at a time. C. Bend their knees and ask them to push with their feet. D. Use a gait or transfer belt to assist with the repositioning. Answer C. Explanation. Moving a resident up in bed can be done if the resident is alert and able to cooperate. Ask them to bend their knees and place the soles of their feet on the bed. Then ask them to hold onto the trapeze bar or side rails. Slide your arms under the resident's hips. On the count of 3, both of you can move towards the head of the bed. Question 50. Which statement about gait bell is not true? A. The nurse aide stands behind and on the weak side. B. It protects both the resident and the nurse aide. C. All gait bells have reservable buckles. D. The gait bell can help break a fall. Answer C. Explanation. Gait bells are made of sturdy material and have a non-reversible buckle. A gait bell provides support and stability for the resident during walking or transfer. When putting on a gait belt, it should fit snugly, with just enough room to insert 2 fingers. It goes over the client's clothing with the buckle in front. Walk behind slightly to the side of the client, grasping the belt from the underside. Always remove it when you finish walking. Thank you for watching.